A very good morning to all of you. We welcome you to the commencement lecture ceremony of the 33rd batch of the Faculty of Medical Sciences, University of Sri Jawadhanapura. Please rise as the ceremonial procession will now commence. Batch representatives of the 33rd batch will now read out the oath on Code of Conduct. New students of the 33rd batch in the audience, please stand.
Code of Conduct as a medical student. As medical students, we will maintain unity and interact proper to overcome the challenges which we face. Unity is our biggest strength. Embrace people from all walks of life, cultures, and identities, regardless of their differences in race, gender, etc. Abide by rules and regulations set by the university and the faculty. Treat all stakeholders with utmost courtesy, consideration, and empathy in all academic activities. We will ensure maintaining healthy, positive, and supportive learning environment. Prevent ourselves from cheating, plagiarism, and all kind of academic dishonesty. Join forces with others to achieve common goals, effectively utilizing individual strengths. Responsibly and sustainably utilize university resources and facilities and take all measures to preserve them to upcoming generations of students. Stay off all forms of vandalism, ragging and antisocial behaviors which discredit the glory and the name of the university as well as faculty in the public eye. Effectively and actively engage with the social well-being. Be mentors and encourage helping colleagues in their learning in a collaborative and supportive way. Respect patients' right to determine who should be provided with their personal information. safeguard the dignity,
safeguard the dignity,
privacy,
privacy,
and bodily integrity
and bodily integrity
of the patients.
of the patients.
Treat patients politely
Treat patients politely
and considerately.
and considerately.
Respect their views
Respect their views,
even if you don't agree with them.
even if you don't agree with them.
Maintain a good personal hygiene
Maintain good personal hygienes
to minimize the spread
to minimize the spread
of infection
of infection
within healthcare facilities.
within healthcare facilities.
Be courteous,
Be courteous,
polite,
polite,
and considerate
and considerate
when dealing with patients.
when dealing with patients.
Communicate effectively with patients,
Communicate effectively with patients,
providing clear
providing clear
and understandable information
and understandable information
about their diagnosis
about their diagnosis
and treatment options.
and treatment options.
Provide care
Provide care
to all patients
to all patients,
regardless of their gender,
regardless of their gender,
ethnicity,
ethnicity,
social status,
social status,
race,
race,
religion,
religion,
belief,
beliefs,
or sexual orientation.
or sexual orientation.
Commit to provide
Commit to provide
clear and accessible information
clear and accessible information
to the public,
to the public,
fostering a culture of transparency
fostering a culture of transparency
and trust in healthcare services.
and trust in healthcare services.
Demonstrate kindness,
Demonstrate kindness,
empathy,
empathy,
and effective communication
and effective communication
in all interactions.
in all interactions.
Not abuse the generosity
Not abuse the generosity
of patients
of patients
in the pursuit of learning,
in the pursuit of learning,
but place concern
but place concern
for their well-being above all else. Ensure one's appearance
ensure one's appearance
and dress
and dress
are appropriate to enable effective
are appropriate to enable effective
and respectful interactions
and respectful interactions
with patients and their families.
with patients and their families.
Refrain from giving advice
Refrain from giving advice
or information
or information
beyond one's expertise.
beyond one's expertise.
Be aware of the limited circumstances
Be aware of the limited circumstances
in which breaches
in which breaches
of confidentiality
and confidentiality
may be justified or required.
may be justified or required.
Thank you. Professor Manori Gamage, Dean of the Faculty of Medical Sciences, University of Sri Jawadhanapura, will now introduce the commencement speech lecture. Thank you.
Good morning, senior professors, heads of departments, academic members and non-academic members, and dear students. It is my great pleasure to introduce Dr. Shantha Indralal to this audience. Dr. Shantha Indralal had his primary education at Ratnapura Ayagama Janapada Vidyalaya and Ayagama Rahula Vidyalaya. His secondary education was at the SOS village Kasbawa, Piliandala. Dr. Indralal joined the third batch of medical students at FMS USJ in 1995. His studies was evident with first class he received for his second MBBS examination, including distinction in physiology. He continued the same trend with second class lower passes at subsequent examinations and finished the MBBS degree being 8th in the batch and 41st in the Old Island merit list. In 2006, Dr. Indralal obtained MD in Medicine and completed the foreign training at Northwest Regional Hospital, Tasmania, Australia. He became a board-certified consultant physician in 2008 and rendered his service as a consultant physician at Kabithigellava, Ampara, Ratnapura and Polonnaruwa hospitals. Dr. Indral got through the Australian medical examination in 2011 and obtained the fellowship in FRACP in 2018. He is also a fellow of CCP Sri Lanka since 2018. His research interest is on stroke, and currently Dr. Indralal is a consultant general and stroke physician in Tasmania Health Services Northwest. He is also a senior lecturer in medicine at University of Tasmania and Bond University of Queensland, in addition to being a director physician training and on examination FRACP. It is evident that he has become a remarkable doctor. On personal note, I know Dr. Indralal as a colleague who was 2 years junior to me when he was in Japura Medical Faculty. We passes difficult times in our undergraduate career, and Dr. Indralal has achieved his current position, overcoming all difficulties and red tapes. When I was given the task to find a suitable person to deliver the commencement lecture from alumni of this faculty, I could not find any better person than Dr. Indralal, and this selection was approved by the faculty board unanimously. Without further delay, may I invite Dr. Indralal to deliver the commencement lecture 2024.
Good morning to everyone, and thank you very much, Professor Manuri Gamage, the Dean of the Faculty of Medical Sciences, today for your kind word of introduction. My dear teachers, Professor Alok Patran was one of our teachers by then, as well as other distinguished professors and the senior lecturers of the Faculty of Medical Sciences, Sri Yawadhanapura, and academic and non-academic other staff, and the most importantly, the new batch, 33rd batch of the faculty and the students. I cordially welcome you all for this commencement lecture, and that you are starting your career in medicine from today. I'm really proud and feel very humbled about this invitation, and thank you very much for this invitation to deliver the lecture today. Sorry about my speech because I've been running around the country since last 2 weeks, so probably caught a small sore throat from yesterday. So, dear students, you may have undergone many hardships during your primary and secondary education, as I did myself. But remember that you are one of the 1,500 or 2,000 odd students who got, among the privileged students, you got into this position to become medical students, leaving all the other 100,000s of students behind. And been so much noise been around the poor facilities, as well as lots of talks about the infrastructure of the faculties among the newly established universities in the country. But you are very fortunate to be a student of my university, which is well established, 31 years old, and also with full complement of dedicated staff. So getting into medical faculty or being a doctor, becoming a doctor is and also in the medical profession, is a cherished dream of the most of the students as well as your parents. So you have achieved that goal, and there's no one can stop you becoming a health professional of this country or in this world. So it is up to you to make the best use of this rare opportunity. Remember, up to now, till you passed your A-levels, you have been studying for exams. Obviously, your target was to pass an exam. But from now, whatever you learn today and tomorrow, that will be for entire your future. So nothing can be disregarded as not useful. And if you do well, it will be your patients that are going to be benefited. And which should be the ultimate goal of any doctor or any health professional of the world. So you should target the benefit of your patients. So that's why you should learn, cultivate your skills and your non-educational, cultural, and behavioral achievements. You should target the benefit of your patients. Medicine is both a science and an art. The science is advancing every day. So you see the diseases in a better way today than what we saw before. And science will help to cure a disease and to make the patient's disease cured faster. But the art of medicine has been there for thousands of years. So where that is the art that make a patient feel better. Curing a disease and getting a patient to feel better are two different things. You can cure a disease, but the patient will not feel better unless you use this art of medicine better and tailored to individual patients. So learn that art from the faculty that I learned the art of medicine, and you've been very fortunate. I can stand on near any podium in this world because of the backbone I acquired from this faculty. I'll also mention later, you might think why we should keep everything in our mind, because we have the smartphones and all the other gadgetics in our hand with all the information. But remember, the day that those gadgetics doesn't function, you will cease as a doctor. So you won't be functioning as a doctor. So you can't let it happen. Once a medical student, it's always a medical student. You keep learning till you die. Updating yourself is your duty and also an obligation to your patients. If you stop getting yourself upgraded, you will be outdated in no time. So during my talk, I will talk about why did you select medicine, why do you Also, I'll talk a little about my faculty and the life in the university. That's what you're going to face from tomorrow. And the course that you do as a medical course to get the MBBS, and a little bit about myself and the future. Why medicine? Among thousands of professional specialties and sort of jobs and professionals in this country and this world, why did you all choose medicine? You can answer, you can give so many answers, but I thought people might talk about to heal the world, heal the people. That kind of a noble sort of idea, which should be the best and should be the target. Also, some people talk about financial stability. Obviously, yes, being a doctor or a professional as a doctor or in any other profession related to the health, you will have a financial stability. And a respectable profession. Be careful, you get the respect from the society and the patients if you become respectable only. So this is a respectable profession. If you develop, nurture your qualities to be respectable. And the job security, wherever we go, as a health professional, especially as a doctor, you will have a job. So one of the things must have been in your thoughts when you chose to do medicine. or can be something else like try to marry a rich person. So it's a good sort of advertisement, and you become a doctor and a professor or consultant. So you'll have a better rich person you can target. Sometimes that will be your parents' force or parents telling you to do medicine and you're forcing you to do medicine. So that has been one of the things among our society, our people in the society. So parents try to navigate children towards what they like. But remember, this is what the best thing that parent forced you to do, because they know the world better than you all and what they have gone through and what they like their children to be. So that's why you should not regret about coming here to start doing medicine, even with the force of the parents, because you too, you can become the best doctor, good doctors, and you can develop the future and you can make your parents happy, but also make yourself happy. And some people will try to go abroad, becoming a doctor, and may have many other reasons. So why medicine in our faculty, my faculty? I entered this faculty as in the third batch in 1995, and this is one of the great faculties in the country, and there's great facilities in this university. It's 31 years old, started in 1993. The first batch entered, and our dean was in the first batch. So that is an idea how old is the faculty and which the age. So we have gained a lot. And the best staff, and still we have my own teachers here, and there's no, I don't hesitate to say the best staff of medical staff is here with us. And some people may have failed to enter Colombo or Peradeniyo because some people try. This is the real truth behind these things sometimes, but that could be the best that you happen to be here than going anywhere else. And sometimes that will be near your residence, so you can come to university from your home. So that may be the reason they chose it. But sometimes maybe you try to get away from your home. That is, of course, being a university student, you like to gain your independence, to get out of your parents' control. So you might have chosen to come here to run away from your home and environment, to be independent and to enjoy your life. That's the, I think, greatest choice. And also because the Colombo, close to Colombo, the capital, and the last would be the best is that it makes good doctors if you didn't know before. And so maybe other reasons. The life in the university is as a whole uni life, not only the medical faculty. It's great, full of fun, freedom. You finished your 13 years of school, no more tuition. Maybe some people still running behind tuitions related. And I can remember when I started doing anatomy, reading Cunningham's, then some people had already gone through some classes before they entered university, but we never needed it. And making lifetime friends. And you might find your partner as well as your friends will be lifetime after being a uni student. And remember, this is the best time of your life. It's physiologically the best, as well as being in the university is the best time of your life. And also, you are now 20 years old, and you've been here. You will be here until maybe you are 26 or 27. So best past of your life. So you have to make use of it, and you make new connections, and also follow sports, music, and also be creative, please. And sometimes it will be sad. You are away from the family and tough life, and issue with food and meals, what we had, and working for schedule, because we need to target, and this is the time starting to work with as a schedule, because, for instance, if I take a leave for the next December. I had to apply now in our country where I am working. So we need to plan the life in advance. So that's how you should be, how you should learn it now to work for a schedule. And you are spending this best 5 years of your life. And it's challenging, and you are living alone. You might have to cook, you have to hunt for groceries, and we will be having financial issues. We had lots of issues like that when we were students, and studies are hard and challenging. Accommodation issues, transport issues, and time management. And we can't forget about our human body and the normal hormone mechanism. So love and sex and things are also behind you. It's challenging to tackle those things. And also peer pressures, maybe drugs, cigarettes, alcohol, so everything is here. So you have to choose the best, you have to filter things as what you are going to be a good doctor, good person in this society. And politics, we can't get away without politics. Even though you try to hide, you will be affected by politics within the uni, within the departments, within the or otherwise the countrywide. So that will affect you. Also, life in uni is stressful. Exams, very stressful. You have to read and study and do practice exam papers. So very stressful. Research, health-related issues. You get sick. Sometimes you will you miss some lectures. Mental health, depression is a very common thing. So you make use of your mentors within the faculty, because you will be allocated a mentor during the faculty. And family matters. Your parents will have issues, and children of your siblings will have issues. You are being a respectable family member. You need to attend those. So those are also making your life your life will be stressful. And economic situation of the country, civil unrest, and lots of picketing, protests, strikes, etc. You go through everything during these 5 years. So course of medicine, 5 years, as I mentioned several times, so many subjects, like 14 to 16, depending on the faculties. And also, end of these 5 years, you are technically a medical officer, but you can't function medicine until you finish your internship. Remember, I know the people try to start practicing medicine from the year 3 or onward, or even after internship, but it's not legal. Being a professional and highly educated group of people, you shouldn't be breaking the laws. So that's you should not do that way. And also, as I mentioned, you will be studying until you die. Little bit about my background. So I was born as in the sixth of family of six, and I was the fifth in the family. It's a remote location in the country. It's called Pitakanda Ayagama, which is a remote location of Ratnapura district. And my parents were farmers and estate laborers. Even until I was in year 3 of my faculty, my mother was going for tea plucking in some glad estates. And siblings were unemployed, they were working with parents, and socio-economic background which was very difficult for me. And it was not only me, but we had similar situation. But I'm talking about myself today without any, I'm not shy to talk about this. So this is the house when I was in, this picture was taken when I was, had the vacation after second MBBS. And then you can see the faculty in the middle. We had only these upper 2 floors of this library building and the next complex. So that's what we had as our faculty, and not only us, about 5-6 batches. We didn't have any other even building apart from a little shed in this anatomy area, which we did dissections. And the top picture there, it's the this is where I'm working at the moment, North Regional Hospital, the 3rd hospital of state of Tasmania, and I'm working there at the moment. This is my school where I entered. This is the primary school I entered like up to year 5. Called Aigama Janapada Vidyalaya. These are recent photos. They are still the same. And this recently when I went there. This is how still we travel to my home. This picture is from these two my children who went to my home last year when they came in July. So this is how people still travel to my village. And this is my second part of primary education, which I did in Aigama Rahula Vidyalaya, which is now a central college. Still, these are very recent photos, 100 years old, but we are still having similar sort of poorly developed school. And I had to walk every day about 6 to 7 kilometers down the mountain to enter the school, and I had to walk back to about 12, 14 kilometers. I don't know how far it is. And then only a footpath, never had any carpeted road or anything, and just inside the bush. And we were affected by 88, 89 civil unrest in the country, and then there were lots of delays. During that time, I changed my career as I started doing some, what called Kitul Malkapille. I started doing some toddy and selling that to make a living. So that's how it started. But I completed my O-levels, and it was actually a record in that year, the 5 Ds and 2 Cs and 1 S was in English, because we never learned English by then. You can see that's Google Map. The blue line is where if you are going in a vehicle, you have to go is 9.5 kilometers. But what I did was, we were just coming down like this school. So never came in a vehicle to a school is 6 kilometers roughly. So, and but the nature that always gave me the freedom of mind, and then calm in the mind. So this is what we were seeing every day in the morning. You can see the mountains, and you can see that in here it's hidden is Adams Peak with Siripage. You can see every day. We could see that every day. These are the recent photos I took. And this is how my the primary school, currently the student, that still they are going to school the same. And this is the road I walk down from my home to the school, but still there is no much of development. So after passing the O-levels, I got this scholarship because I wouldn't have done bioscience at all, because I didn't have, in my school, we didn't have bioscience for the A-levels when I passed my O-levels. But somehow I got this scholarship from the SOS Children's Village, which some people might know is an orphanage. So it's the concept of Mr. Herman Miner, who started this worldwide orphanage called SOS, Save Our Souls, see the SOS stand for. And then these scholarships were offered poor and difficult students who had hardships for studies. So they selected me as one of the 7 scholars. So out of those 7 scholars, 3 of us did bioscience, and the 4 of them did mathematics. So we studied, we entered into the SOS Children's Village, the orphanage. So we were internal students, so we were children of the village. So the photo here is Mr. Herman Miner, who is, I consider my second father, but I never met him. But he's the person who invented this SOS Children's Villages. We have about 7 villages in the country now, but then we had only at Piliandala, Casbah. So those are the few photos of the village. These are the houses and part of school. And this is me when I was at this school. And so we were living inside the village with the mature students, children like after 14 years of age. The boys were taken out from the rest of the children, and then we were in a place called Youth Village. Part of this is the behind is the Youth Village, which is also in the same premises. And I passed the A-levels on the 2 Bs and 2 Cs, and I get a grade score of 257. We didn't have state scores by then. So I completed O levels in 1992 and entered faculty in 1995. We had almost 3 years of gap between A levels and the uni entrance, and I did several jobs. I collected tea in a tea factory, and also I came to Colombo and I got into a house which had two deaf students. I taught the deaf students for about a couple of years, 1 year, and then got a teaching appointment at my second school. It's a temporary thing. I was doing this at one stage of my life before I entered the university. So entered third batch, I mentioned there were 120 students, many difficulties. My colleagues, my friend helped me. I got another scholarship apart from Mahapala, from different organizations. So I could go through the course with so many difficulties, and also the support from the peer group and also the seniors, and especially first and second batch colleagues, they were really helpful for many things like our accommodation, our studies and everything. So that was unbelievable. And I think that you all should practice the same and follow the same help, and you should help the juniors and in many ways, studies, hardships, everything. So that we received those and we had lots of challenges with English because I didn't learn English as a language at all. So, and we have financial challenges, language challenges, social, family challenges, and also we had common issues for everyone, apart from not only for me, and it was common to everyone, and then passed the MBBS in 2000. As our dean mentioned, I worked in this institute, but I migrated to Australia in 2017 because even after becoming a doctor or a physician, the challenges never ended. There were two reasons I had to leave. The first, I felt lack of use of the knowledge I gained and also skills sometimes. So that was challenging, and we had to go according to the flow. So that was always making a hard thing in my life, my heart. And then I was thinking about the next step of migrating, but there was a second trigger where our family met with an accident, which my wife and children were involved, and wife was unconscious for 4 months, so that I couldn't function here, working at Polonnaru Hospital, and we were in Colombo. My wife was a teacher at Nalanda College. I couldn't function with that distance and things with the children going to Nalanda and Devi. So decided to take a challenge. I took my wife and put into a wheelchair and went abroad. That's how I entered. Currently, I entered this university because I did my foreign training in the same university, same hospital, where they were keeping an eye on me and they were chasing me all the time to come and work there. So I just sent an email and they took me there. So I work as a general physician, stroke physician, and covering 1/3 of Tasmania now. And you can see this is the orange color is the part that I'm covering as a stroke physician, and also director physician training, and a senior lecturer at the Uni of Tasmania, and also academic advisor at this is the Griffith University and not the Bonds at Gold Coast. And then I'm committee member of RACP, Royal Australian College of Physicians at our Tasmanian committee, and also fellowship examiner, and statewide stroke pathway, I'm committee member as well, and we are handling the whole state stroke, acute stroke and hyperacute stroke care. And also very recently I've been offered as a peer review interviewer for the overseas trained physicians from the College of Physicians. I'm proud where I am at the moment. It's always, no one could be happy without serving your own kith and kin. So I'm always thinking of coming back whenever the situation is better. We always also train our students, our SRs, to do the foreign training, and we give paid jobs for them in general medicine. So we get 1 or 2 student SRs every year. So currently we have 2. So these are some of the things I did as well. You can see that advocate first paper page at 2019 when we started this acute medical unit in that my hospital, and this is the part of online version of it. And this is the stroke unit we established last year. So this is myself, and some people might know him, one of our senior registrars who work in Kalubowila. Now he's with us, and as a part of our foreign training. So the secret behind my journey, if I say that I'm successful today, is look at this mango tree. You can pick a mango trying to throw a stone to the lowermost fruit here, but you might miss it. You have to target the top. So always try hard and target the highest. So that's how you should succeed, and you can develop your skills. You can study for exams. You should study the subjects to target the best or the highest. So then you will not fail the exam, and you will reach at least in the middle. But you can definitely target, you can reach the top, that's the best, but at least you can reach somewhere there. So to do the best, you should know the best and should develop the skills well. So without that, you don't know what's going to happen and what's happening in the world. So without knowing that, you wouldn't be able to offer that service to your patients. And we should learn, and you should know the best and practice your skills and develop your skills to the best. For you, the key principles for success at the medical school. Passion. It's important to find and nurture your passion for medicine. You should love medicine. Unless you love that, you like it, you don't perform well. And purpose. Decide why you are doing this course. Why you are doing this course. And you have to have a purpose. And resilience and adaptability. If you are not adaptable and you can't overcome these obstacles. And the determination. You should determine, and you should have the determination till you complete this course, and even after that you start doing postgraduate, and until you come and you are happy about your life. You have to have the determination. And continuous learning, as I mentioned, till you die. In the uni, you should have studies and life balance. Study is part of your life, not the whole life. So studies and life should be in a balance. You can maintain a good health by maintaining studies and life in a balance, not giving one a priority. And do sports, please. Cricket, tennis, badminton, swimming, etc., many things. Please do a sport, at least one. And that will make sure your mind will be calmer, and you will learn how to face challenges, and also you can forget about your studies and hardships at the university as well as with your family. And music, it's an essential tool. Please try and sing or play a guitar or something. Do some music as a part of your life. Make good friends. They are going to live with you till you die. And group studies are the best. So that will make sure everyone, you can't, one person cannot learn everything. So if you share things, that will definitely make yourself better, your knowledge will be better. And also sleep well. Our human body is not a machine or a computer. Our brain functions with the help of neurotransmitters. We produce our urine and semen and everything and sweating, that all should be produced somewhere. Similarly, our brain works with neurotransmitters which are produced during our sleep. So it's essential to have a good sleep. Don't try to learn and study without sleeping. At least 6 hours or more sleep is essential to maintain your integrity of the brain functions, as well as to maintain adequate amount of neurotransmitters to function. Otherwise, you will be coming to the lecture like this and fall asleep because you don't sleep at night. So because your the neurotransmitters will be used up, the remaining transmitters will be used up very quickly. And look ahead of your life. You have a bright future. There's no doubt about it. So don't be negative and overcome the challenges. They are part of your life that will never end. Even today, tomorrow, we'll have challenges for our lives. So why not yours? So there's no end to the challenges. So you need to face them and make it as a part of your life. And don't let those things take your life. And language issue, I like to talk about this because it's a common issue for everyone and most of us. And it was worse than now by then when we were students. Do not feel shy about English. And English is a foreign language, so it's not your language. So don't feel shy about your poor knowledge or lack of your knowledge in English. And also, if you consider capable of understanding and facing this challenge of studying medicine, it's very vast discipline and English is nothing. So you are capable of doing that medicine, but then think you can easily do English and just let it happen. Don't make it as a hard thing. Just remember your colleagues who are forced to go abroad. Sometimes, as I mentioned, maybe 2,000 or less than 2,000 students out of 300,000 students who face A-level exams in this country would be able to enter in medical faculties. But some of those bright students will not have the chance, but not get the chance to enter the medical faculty. They will go abroad, like different countries, not the UK or Australia, but sometimes they will go to Russia or many other countries. So they have to learn a completely different language right from the beginning and then follow the course in that language to become a doctor. So you are very fortunate. You learn English from the day one. First time, probably your preschool teachers could have spoken in English at least one word. So you learn, you hear English and your smartphone and current world, lots of things. So it's easy for you, not like going abroad and learning a completely different language. So make this as a challenge. Speak to your colleagues as many as possible in English. And also definitely with your tutors and teachers, always in English. So it will be broken at the beginning, but you learn it, you practice it. Without speaking a language, you won't learn it. And tomorrow you will be getting so many doors open, millions of opportunities, and this will be taught to you or given to you at the end of the course. And we have career guidance, lectures, and opportunities in the future when you finish. And you can become a general practitioner or a career medical officer, and administrative specialist or a person like even director general or directors in the hospitals, and so many specialties like physician, surgeon, so many, and subspecialties like radiology and cardiology and everything. And also our academic staff, you can become one of those, and you can completely change your career and do business or research or many more. So your future is very bright if you function properly. But don't be a car doctor. There are two things about car doctors. You can, if the car is broken, you can remove a part and replace, and you can get the vehicle to function back to normal, but not with our human body. You can't do that in that easy way. So also, once you get through college and becoming a doctor, you start chasing cars, not treating patients. You talk about your finance, you talk about your wealth, you look about the best car to buy and best house to build, but don't do that. It's not the life. We live here only about 70, 80 years. The world has been there 40 billion years. the planet been there 40 billion years, and human being in there many billion years. So we are here very short period. We are here to go. So don't think about those. Help your patients. Think about your patients and make yourself happy. You are highly respected tomorrow, and you should be respectable. You have to be behaving the way that others respect you. If you don't do that, we have lots of examples around the country currently, but please don't be like that. And you are highly paid. So one of the highest paid profession in the country and in the world. So you should be responsible for your payment you get to the society. And also, you are highly educated. There is no doubt about it. You did the best in A levels, that's why you are here, and then you are doing a medical course of 5 years and postgraduate. You're going to be highly educated, so be humble. So you should be humble. So when you go up in the ladder in education, you should go down with the crowd. You should be humble. And you are highly responsible to the society, so be committed. So you can't say cancel your clinic and go on a trip. So you have to be committed, because there are tens and hundreds of patients waiting for you. And life is stressful, as I mentioned, and be adaptable. You might change your job today and location today, and tomorrow going to start in different country or different location, and there will be completely different patients, people, work environment, but you should be adaptable. Especially when they come for foreign training, it's hard, it's completely different life, but you should be adaptable, and then you can work well. How to be a good doctor? Empathy. And empathy is an essential part in our patient care. You should feel what the patient feels. So it's going to be your problem than the patient problem. So then you find the best for the patient. And also be understanding and compassionate towards patients. As my experience when I started working as a doctor, and when you see patients, they talk about the location they come from and where they travel. So I felt it because I experienced it myself. So we take additional steps. Okay, don't ask the patient to come tomorrow and show the report, because it's hard, very hard for them to come to you tomorrow. So we try and understand who the patient, and you should be compassionate towards patients. And legal and ethical commitments that you have also, especially to follow guidelines. If you follow a guideline, if you don't follow a guideline, there's a legal things behind you. So you should follow guidelines. For instance, if you have microbiology or antibiotic guidelines, so if you don't follow the appropriate guidelines, if you choose a different medication, you might harm the patient or harm the society, because we'll develop resistance, and the whole world will fight against this antibiotic resistance. But that's one of the things. Even surgery and things, you should follow the guidelines. And when it happens to come to the court cases, if you haven't followed the guidelines, you are in trouble. So please follow the guidelines in your medical career. And make connections with the patient, relate to you and your family whenever you see a patient. And then you will do the best. And be relevant, stay updated, and you should never expire. And enjoy what you do, then you will never have to work even a single day. If you go to work, it's hard. But if you go to enjoy your thing that you do, you don't work, you just enjoy it. So do that, enjoy your work so that you don't have to work. And the future of medicine will be completely different. And medicine we learned 30 years back with much different what we have today. So we can't even think about what will be the medicine in next 30 years. Please be ready. So new imaging, new medicine, new keyhole surgeries, they started coming when we were students, but now they are here. Robotic surgeries, already here. I think Professor Alok Patranas might know, so many robotic surgeries are here at the moment. And immunotherapy, they are very targeted treatment for cancers, we already here. artificial intelligence. Artificial intelligence are being used in many places, and especially in my case, I use it for stroke imaging. When a patient gets the brain image, CT perfusion scans, within minutes, the report comes to my phone. That is the artificial intelligence that we use in that programs. So we have bypassed the radiologists for this. So, and this will come for many things. And bionic limbs, bionic eyes, if you have heard about. So those are, the brain thoughts could be converted to electric signals, and that will be transmitted to artificial limb for a person who had amputation. So that's already here. So this, what we can talk about things now. And Neuralink is almost here, and Elon Musk has already implanted first chip to a human being. So this will be bread and butter for you when you think about your future. Maybe in 10, 20, 30 years' time, these are like day-to-day life. So we can't think about what happens next, and also sometimes that will challenge your job, like I mentioned about radiologists being bypassed for stroke imaging for now. So that's one of the things, but there may be some things will replace human being, but you cannot replace the art of medicine by putting machines. That's only you. You can practice art of medicine. So learn that from the faculty. And please be ready to face these challenges. These are the bionic limbs I've been just talking about. Brain signals will be transmitted so that you can get a new completely artificial limb, which is not needing any other thing except you think about you walking. And I've heard about Stephen Hawking, who was an astrophysicist who got motor neuron disease, but he still delivered lectures by using this special computer where he was thinking only. He couldn't make a noise, he couldn't talk because the throat was paralyzed from motor neuron disease, but he still could deliver lectures by thinking about what he wanted to say, and the computer was making the voice for him. So these are already here, and this is about the Neuralink. And they initially practiced on a monkey who could play a computer game after implanting the chip. So this is going to be the future for you. So be ready. Right. So the way to get started is to quit, talk, and start doing. That's what Walt Disney said. Finally, I congratulate for your great success in the A-levels, and also all the best for the life at the Faculty of Medicine, Sijawarnapura, and also in your career in medicine. Please live like you die tomorrow, but learn like you live forever. Thank you. Thank you very much for this kind invitation. I'm really proud to be standing in front of you. Thank you.
Thank you, sir, for your illuminating words. Next, I invite Professor Manori Gamage, Dean of the Faculty of Medical Sciences, to present the token of appreciation to Dr. Shantha Indralal. Thank you, sir and madam. Next, I invite Professor Sugandhika Suresh, coordinator of the orientation program, to deliver the vote of thanks.
Thank you, Vinod. Good morning, ladies and gentlemen. As the coordinator of the orientation program, it is my privilege, honor, and pleasure to propose the vote of thanks at the end of the commencement lecture 2024. First and foremost, on behalf of the Faculty of Medical Sciences, University of Sri Jawatanapura, I would like to express my sincere gratitude to Dr. Shantha Indralal for accepting our invitation to deliver the commencement lecture today. And your lecture today to the students of the 33rd batch of medicine at our faculty I'm sure has kept lasting impressions in their minds, and I'm sure they are carrying your words for their life. Thank you again. I would take this opportunity to thank all the professors, heads of departments, academic members, and the non academic members for your presence here today. And I also take the opportunity to thank all the academic members, non academic members, and also other members from the university. It is not only the faculty that helped to conduct the orientation program 2024 successfully. Without your assistance, we would not have been able to conclude the orientation program in a successful manner. So, dear students of the 33rd batch, you have just started your foundation module. So, you are starting your medical school career today with the hope of realizing your dreams of becoming a doctor. So, as Dr. Indralal said very aptly, so you have to live like that you die tomorrow, and you have to learn like you are living forever. So, whatever that you do in the faculty, please pay good attention, and we have arranged all the teaching learning activities for you all to gain the knowledge, skills, and attitudes. So, as you have taken your oath and promised, you are going to be, I'm sure, responsible citizens and responsible medical students and responsible doctors in the future. So, on behalf of the staff members, I wish you all the very best and hope that you spend the happiest years of your life at our alma mater. Thank you.
This will bring an end to today's proceedings. Please rise as the procession leaves the hall. I wish you all a pleasant day ahead.